For more than 5 years, the HCMA has brought people together through online discussion groups for newly diagnosed patients, caregivers, women with HCM, and young adults. You are never more than a few hours away from support, understanding, and shared experience. This February, HCMA launches a new men's group. Find the next discussion on the events page at our website.
Hello, everybody. It is February 2nd, 2026. This is Tales from the Heart. I'm Lisa Salberg, your founder and host. And today I'm doing this podcast with my heart in my hands, literally, for those who can view this, as today is my 9th heart anniversary. So 9 years ago today, I was in the recovery room waiting to wake up with my new heart. Her name is Brandy, and this is the old one. For those who want to take a good close look, her nickname, well, we'll hold that till the end. I have a very special guest joining me on a very special day, and that is Senator Carla Nelson from the great state of Minnesota. And my question to Carla is, when is the first time you heard the words hypertrophic cardiomyopathy?
Well, thank you, Lisa, and so happy about that 9th anniversary. Well, you know, it's interesting. I didn't even understand the word. I had a sprained ankle, was seeing a family med physician to get all fixed up with this bad sprain. And of course, he listened to my heart and said, well, there's something that sounds a little funny here. And I said, oh, yeah, I know. I've had this heart murmur since I was in 4th grade. I'm just great. I'm a former distance runner. My heart's fabulous. I have a low pulse rate. And anyway, he said, we learned about this thing called hypertrophic cardiomyopathy. And it sounds like you might, I should really refer you to one of our specialists about this. And of course, I was very dismissive. And I said, look, I'm fine. Thanks for telling me, but I'm really not interested. But, I'll keep it in mind if ever something comes up. But then, I just said, well, what is that word again? I never heard of that. And he said, oh, its nickname is sudden death. And that is a jolt. I immediately perked up my ears and said, oh, yes, tell me more. And of course, I saw the specialist, and lo and behold, I did have hypertrophic cardiomyopathy. And as the time went on, we found out it was obstructive on top.
And what have you personally done to manage your obstructive HCM?
Well, at first, the good thing is, because of this really, I would say, accidental diagnosis, I was able to manage. I mean, I didn't really have any symptoms at all. But so about a year later, when I started having some symptoms that normally you would just push to the side, like, oh, I'm getting tired when I walk up the steps. But, this is steps in the Capitol, and they're, 2 stories each, and maybe I just didn't get enough sleep last night. I knew not to just brush those aside. And I spoke to my medical provider, my physician, who then, encouraged that I get the additional tests. And while I thought it was really nothing, it did show that I had hypertrophic cardiomyopathy, and we did monitor it for about a year. And the good news is, again, just that education, just that knowing what to look for. And when I was at the Capitol and started having this great fatigue, and then feeling my heart like it was beating out of my chest, I knew what to do. And I immediately got in for all the testing, and then realized, I need to have open heart surgery. My physicians certainly realized that, and I was very thankful for the almost accidental care that I got. The care was very purposeful, but to me it seemed accidental because it just came from a sprained ankle. But I am thankful every day for those physicians who were alert, astute, trained, and they told me. And then we got the care that I needed. It's truly a story of great gratitude.
So when you told me how you were diagnosed, I said, well, you're not alone. We have a lot of people who get to their HCM diagnosis in midlife due to knee problems, elbow problems, ankle, feet problems. They hit the orthopedic. That stethoscope goes on the chest and they go, wait a minute. You said something really interesting, though, that you had a heart murmur since, the 4th grade?
Yes.
Did anybody else in your family have heart murmurs or anything going on cardiac-wise?
No, not that I'm aware of. And fortunately, I think I was old enough when I was told that at about 4th grade to kind of remember that. But no, I had no problems, no recollection that anyone else had heart murmurs or heart issues.
And today, has anybody else in the family uncovered any more HCM hiding anywhere? That typically happens in our families.
Yes, that is a very good question. I have 2 brothers, and of course, they are going with their physicians. I don't know the exact status on what's happening there, but they are aware. And then my husband and I have 3 sons. And so our 3 grown sons are aware too, because, the chances 1 out of 2 will have this also. And so they're definitely monitoring with their physicians as well regarding monitoring and keeping track of what's happening, and hopefully also being proactive also if they have any symptoms as well.
I'm glad that your family has the knowledge to know they should be questioning with their physicians about their family heart health history and how it might implicate their health going forward. And that's kind of why we're talking today, is to help families get that information to discuss with their healthcare providers. So first, I want to give a good shout out to our friends in the state of Minnesota, because they have a proclamation for HCM Awareness Day every year. And we thank the state of Minnesota for that. But Carla, what else can we do at the state level? Can we work on the Children's Cardiac Safety Act? Can we drop a bill? Do we have a number?
Yes to all of those things. We do have a bill draft for the Children's Cardiac Safety Act. We can be glad to talk about that. I want you to know that session starts in a few weeks here, February 17th. And so I will be able to drop the bill for its first reading at that time. And we do have model language that has been really precisely tuned to what Minnesota already has in law regarding physical exams for athletes and those type of things. So I think we're in a very good position. I'm very excited about this. I'm very hopeful that we can move this forward. Minnesota is a state that is really interested in health, really interested in preventive things, very interested in making sure that students are very well protected and aware and have the medical care and expertise that they need.
So we are really appreciative of that. And we know that it's a little early in your year, so we don't have an actual bill number, and we have to kind of wait for everybody to go back to work to do this. So we are looking forward to that bill number. And for all of our participants in Minnesota, we will be able to drop that bill number so that they can ask their elected officials to jump on as a co-sponsor or to come up with a matching bill in the assembly.
Let me just say that is absolutely key, is to that organic letters, emails to one's senator or House member. And there will be a House companion dropped as well. And so that's key, is that organic request from constituents to make sure this bill gets a hearing, make sure it gets out of committee, make sure it gets to the Senate floor and for a vote.
The conversation continues, but first, this quick break. This year, the Hypertrophic Cardiomyopathy Association marks 30 years of connecting patients to expert care. During that time, HCMA has recognized more than 60 centers of excellence across the United States. These programs use a multidisciplinary team approach to help you manage life with HCM with access to the latest diagnostics and treatments. One patient says his center helped him finally finally feel heard and confident in his care. To learn more, visit the HCMA website and use the Centers of Excellence directory to find the right program for you and your family. Once again, here's host Lisa Salberg.
Well, we have a lot of great families that I've been able to work with for, oh my goodness, almost 30 years now in some cases in Minnesota. And we have our fantastic partners at a little place that you know down there in Rochester, Minnesota, a little place called the Mayo Clinic where you had your surgery. So we know we can guarantee we're going to get some support from our friends down there at Mayo who are taking such great care of our patients, and many of which have had surgery there. In fact, for many years, there was only a handful of surgeons in the United States that could do this surgery. And I helped a great many people travel to Rochester, Minnesota for their first visit. Most of them preferred it in the summer, though.
Yeah, well, definitely understanding that. But how rewarding it must be to know that the work you are doing is changing lives, actually saving lives and preventing a lot of distress and sadness. That must be very rewarding.
So we did not discuss this in advance, but boy, did you just step right into our campaign that we're going to be kind of debuting on HCM Awareness Day. And that's HCM Inside Out. And I'm going to watch Demi on the backstage here smiling at this one. We've created a whole host of little characters to talk about the emotions that go behind having HCM. And oddly, some of them are gratitude and hope and joy, and others are anger and stress and anxiety. But knowing them all and knowing that they're all normal and that we all process them in our own time when we get diagnosed, and that we're not alone in them. I was 12 when I was diagnosed. It was a little different. It was 1980. But now you get diagnosed, we've got treatments, we've got targeted treatments, we've got ways that we can protect people against sudden cardiac arrest. And it's not like it's cutting edge. We've been doing this for 25 years now. So we were actually even more, 32 years really. So getting defibrillators and those who need them, getting the right treatment in the right hands, all matter. So yeah, you're gonna enjoy our characters that are coming. I can't wait
to see them.
They're so cute. Well, you can get a sneak peek on the front page of our website at 4hcm.org right now. So tell us a little bit about the process for Minnesota to get a concept like, let's get everybody to talk about their family heart health history and a well-child examination. How do we take that from a concept to a law that can be implemented?
Oh, that's a good question. We have great revisers that I have been working with in the Minnesota Senate to put this concept into actionable law. The action comes, of course, after the House and Senate pass it and the governor signs it. But it's our job to make sure we get the language correct to start. And we know there can be amendments and such. But so the research showed us what was already in Minnesota law. We don't need to duplicate that, but we certainly want to add on to that and expand that. And so we're looking at also building upon current law, quite frankly, regarding pre-screening for student athletes. This is something that our state is already doing. We are, in a sense, a state of health. And so we're already doing that, but it didn't exactly include hypertrophic cardiomyopathy as a focus or as something that should be looked at as far as potentially needing further examination. And so the first section of the bill does that. It's about pre-screening for student athletes, building upon current Minnesota law. And it includes I always like my legislation. I think good legislation also includes always kind of a review. Okay, what did we find out? How many screenings were there? How many of those led to some sort of further evaluation? How many diagnoses were there? So you know what the impact is and the effect of the new legislation. So having those type of metrics and data is also part of Section 1. And then section 2. And so that would, I kind of see this being implemented in phases, perhaps, if need be. So that is phase 1, pre-screening of student athletes. But we really would not want to limit this to just student athletes. Certainly, hypertrophic cardiomyopathy or HCM, if it's obstructive like mine is, isn't limited to just athletes. So we want to be able to have this type of screening as well for all of our students, again, with the same metrics as far as, well, what did we learn? How many screenings were there? How many were resulted in further evaluation from a physician? So that's important. And then the third thing, again, we're just building off of a current type of laws that we've done regarding health issues, and that's to provide education materials for children and families. We did something very similar to this when I think I was almost a freshman in the Senate, passed the hands-free CPR legislation for our schools in Minnesota. So we're kind of following that model. It's been very, very successful. And then lastly, professional education for healthcare professionals. I think that probably is hopefully already moving. I know it is, but we want to make sure that education also does focus on HCM or HCM. And then we just asked the Department of Rules to look at the Administrative Act so we can adopt these things. That's just kind of a boilerplate piece of language there. So it's very simple. It's really based upon other similar type health initiatives that we have put in law regarding school kids. And this is kind of how this starts here.
So I'm going to bring up a quick little slide that we've looked at for the prevalence of HCM and the other diseases that could be identified through the well-child inclusion of asking family heart health history and improvement of pre-participation screening physicals. So when you have diseases that are not completely clear on their prevalence, we take the high number and the low number so we can look at both of them together. So if we were to look at all the people in Minnesota, we know that there's about 28,000 adults and peds that could be identified with HCM if we were looking, and about 11,000 on the low end. So that's a lot of people and that's a lot of families. But we also know that there's dilated cardiomyopathy, Marfan syndrome, long QT, short QT, Brugada syndrome, CPVT, anomalous coronary arteries, which is the second leading cause of sudden death in young athletes, congenital disease, and that means that the population of Minnesota alone with heart diseases that could be currently undetected are somewhere between 61,000 and 181,000. If we can find half of those families through better screening, we're going to be in a much better place than we are today. We know that in the United States total, there's about 200,000 people who've been identified with HCM and are under treatment for it. So that's only about 87% that we still haven't found yet. Or no, I'm take that the other way. 82% that we haven't found yet, and the rest of them we have found, which means the other diseases are probably less commonly diagnosed because they're harder to identify. You don't have an echo to look for it necessarily, especially with the channelopathies. So there are a lot of people living in Minnesota right now with probable undiagnosed HCM and other congenital defects or genetic defects that could impact them. So we want to make sure we get to them in time, because that's a lot of people out there at risk. And you and I both know very well and very personally that it's not a nice disease to have, but it is treatable. And there are pathways, and we can screen our families once we have the knowledge. So it is great that you are helping us in the state of Minnesota to make sure that more Minnesotans can have the opportunity to have that discussion about their family heart health history and take appropriate action. Is there anything other than our constituents and the listeners calling once we drop a bill number and asking for support from your peers in the Senate and in your House? What else can we do to raise awareness? Do we have to come out and build snowmen in Minnesota? Cold there right now.
You won't have to do that, but I think you do ask a very good question. And I think building awareness is key. You've already mentioned some of those things. I also think partnering with the many organizations that we have in Minnesota, the American Heart Association comes to mind right away, and many others.
They are partners of ours. So the American Heart Association and HCMA have joined powers this year, first time ever, where we're both going after the same exact legislation, and they're going to help us raise all waters because they're better at this than we are. I'm just a small organization that's been around 30 years. They've been around 100, and they have a bigger budget and more people on their team. So they're going to help us with this lift, and we're super happy to have them on our team.
Absolutely. Those are great teammates. And so I do think public awareness is key, and it would be great if there were some public service announcements. I know some of our TV stations look to do public service announcements, and they offer doing them free. It's without charge because they realize how valuable that is. So I think all of those things, I'm a former educator, former teacher, and I think education is powerful. I think education is powerful when it comes to something like this as well.
I love the educator mind. One of our pillars at the HCMA is education, no matter the source of who we're educating. So sometimes we're educating lawmakers, and sometimes it's families and patients, and sometimes it's clinicians. But it all comes down to understanding the fact that we all have a human heart, no matter our political persuasions. I know there's a lot of polarizing talk out there today, but we know we all have hearts, and we know we all want everybody to have a healthy existence. So the good news is all of this is bipartisan. The better news is we can make a big difference with some just simple conversations. I know people don't like to be told what to do, yes, no, with their health, and I'm right there with them. But if I'm having a conversation with my chosen healthcare provider and they say, hey, you're at risk because your grandfather died young and your father had these problems and your sister had that problem and you have this murmur, okay, I'm listening now. You've got my attention. So we have to make sure that we're having as many conversations as possible with all of the people in our lives that matter. And sometimes, and I'm sure this has happened to you, you're having a conversation and you mention your heart problem and somebody goes, oh, wait, me too. And you start peeling back the onion and all of a sudden you find a big-hearted friend much closer than you ever expected. Has that happened to you yet?
Yes, actually, you don't realize really how prevalent these type of issues are. And that's one of the things that I hadn't really thought about with my public platform as a senator in the state of Minnesota. But this is something that I feel I'm really glad to have the platform to share with people about how important this is and how important it is they work with their medical team and that they are aware. Goodness, I was in my 60s. I'd never heard of this. Very smart woman. And I thought very well informed. And yet here it's like, what is that word? I have never heard of that word before. So I think I just don't think there's any way to replace education. And people like to know. They like to know about their health and their bodies, and they like for preventative things. And so, and also to be able to have the choice about, well, okay, I have this. So now what are my options and how can we monitor this? And so that there's not an emergency, but you can maybe plan better. And I think all of that comes with education. So I just really want to thank you also for actually setting the stage last year when we did the proclamation in the Minnesota State Senate. And I think that might have been the first time that many had heard about what is HCM and why would you want to know more?
I love the way you're using your platform to talk about it openly. I think we need to do that a little bit more because some of us of a certain age, and I'm close to your age, we were kind of taught, shh, don't talk about health problems. Shh. And that's not going to help anybody here. We need to talk about it. It's out there, it's common. And the more we talk about it, the more we realize that there are people all around us. In my own circle of business, before I did this, I was a human resources manager. And the guy who did all my help wanted ads back in the day when you actually had to write them in, if you remember that. Yeah. Years go by and his brother died the year before my sister died. We didn't connect the two, but they were both sudden deaths in their 30s. And about a year and a half ago, he called me up and he goes, you know what my echocardiogram says? I'm one of you. And I'm like, that means your brother was one of us too. And like we put it all together. I've known him for 40 years, completely unrelated to heart advocacy. So we're hiding in plain sight. A neighbor's kid came over and was diagnosed. Another neighbor's kid was diagnosed. So we're everywhere. We're your family. We're your neighbors. We're the people across the street. And we don't look like cardiac patients. I don't know what we're supposed to look like, but we look like everybody. We're everybody. We're every age, gender, ethnicity, occupation, from a state senator to others that have been in the state house. Former state senator here in New Jersey, Tony Bucco Sr. He also was a big-hearted person. His son will be joining me later this month to talk about what we're doing here in Jersey. And we're everywhere. We're in the state legislature. We're on Capitol Hill. We're every place. So we might even be in some governor's mansions soon. Who knows? I got some things working on with some other people. The good news is we're out there living our lives, trying to give back to others when we can, and trying to raise awareness when it's appropriate. And we really appreciate you stepping forward in this way for the state of Minnesota. Excuse me. I'm getting over a cold from Christmas. This is the bad part of having your heart in your hand. Your immune system is shot. So it sticks with me. Sorry about that. So anyway, is there any last words? I don't want to take a lot of your time today. We've been together a half an hour here. Is there anything else that you would like our listeners to know about this particular piece of legislation or HCM in general?
Sure. The one thing I would want people to know is how prevalent HCM is. And I learned a long time ago not to speak to statistics with numbers without them in front of me, but you might know the prevalence. It's very much more prevalent than many other well-known diseases that we hear about on a regular basis. So I think what we're doing today and what we'll be doing as session starts is very important, just so people are aware. I think that is a key thing. And I just want to thank you for offering me the time to visit with you today. I learned a lot myself.
Well, I couldn't be happier to share my heartiversary with somebody than a state senator who's willing to help us pass the laws that will help find and identify and get families to where they need to be in time, because we don't always get to midlife unscathed. Some of us have stroke, some of us have cardiac arrest, some of us have debilitating symptoms. So if you're not sure what's going on with your heart and it feels a little off, or you know you have a family history, please talk to your chosen healthcare provider about what might be needed to check your heart a little bit more closely. And hopefully soon, like here in New Jersey and a few other states around the country that are starting the process, in your well child examination, you will be asked about your family heart health history, which will give you a moment of pause to stop and think about what you know and what you don't know, what the family history is and what the family myths are. I will leave you with a little educational drop point. When somebody dies unexpectedly and the paramedic shows up, the paramedic will often try to figure out what's going on and say things out loud. And they'll say something like, I think they had a stroke. I think they had an aneurysm. I think they had a cardiac arrest. I think they had a heart attack. And whatever they say sticks in the ear of the person that was there because it's a traumatic moment. If somebody in your family has died from anything cardiac related, please discuss the death and the circumstances surrounding it as best you can. Was it sudden? Was it protracted? Were they in a hospital? Did they just go down? Because what you tell your healthcare provider could change what tests you get next. So be sure that they know your family history, not family myths. And if you don't know where a story came from, ask, do we have an autopsy? Did the doctor say that? Where do we know this from? Before just saying, well, they smoked and they didn't eat well and they died at 40. It's not typically what happens. So please get the facts and give them to your doctor. So that's probably the most important thing I can start Heart Month with, is know the truth and start from there. And if you're not sure, it's okay. A lot of us aren't. A lot of us don't know the family truths. They know what has been passed down through generations. So take the time and talk about it. It might save a life and it might even be your own. So
thank you. Very good.
Senator Carla Nelson, I thank you so much for joining me on Tales from the Heart. I hope to have you back many times over the years to talk about how much progress we're making in the state of Minnesota.
I look forward to that. We want progress. Thank you so much.
We definitely do. Thank you for joining us today.
The Hypertrophic Cardiomyopathy Association would like to thank our sponsors, Cytokinetics, Bristol Myers Squibb, and Edgewise Therapeutics.